Hi, I'm Kelly. I'm practice nurse lead for Radox, which is a GP practice. We've got two surgeries, one in Newtown in Birmingham and another one in Aston Pride.
So the practice has been running for around about 40 years, and I've obviously been there for quite some time. So I've seen a wide range and different people come and go, different cultures. The older generation and people that have probably been there for years tend to become isolated.
We did a little bit of research into it. And we were looking at how the impacts of loneliness can affect people's health and well-being. So it can affect their blood pressure, depression, stress levels. We sort of nominated ourselves really to be the loneliness champions. And then the wider team, so we had healthcare assistants, assistant practitioners, other nurses and reception team members and our GPs, they would attend.
When they sit and talk together and get together, they obviously realise they may have same problems or the reason why they don't come out of the house and they stay in, so bereavement's one of them as well. So it's very good to have a coffee morning and get everybody together, all ages.
As a practice, it would be nice just to be recognised for something we've done that was over and above, in my opinion.
I'd feel very proud. I'd feel very proud for everybody, not just staff at Radox, but for patients as well, because obviously they keep coming. They're the ones that will keep it running. So it would make me feel good all round. Yeah.
I'd feel really proud of the whole team because a lot of people have put a lot of effort and have given up their own time to make it work, and it means a lot to everybody how they help our patients.
I've nominated Sonia Simpkins, who's the business manager of Hawes Lane Surgery, because she came on board with a pilot project that I'm as the clinical lead for the CCG around identification of signs and symptoms for patients who've suffered from domestic abuse. The actual pilot program's called IRIS, which is Identification and Referral to Improve Safety, and really it crosses the whole spectrum of the safeguarding agenda. So it's not just looking at how domestic abuse manifests itself and how it affects people who suffer from it directly as a victim, but obviously the safeguarding implications for children and the wider family that live with domestic abuse every single day. Sonia is quite remarkable really in terms of her understanding and her willingness around safeguarding not just vulnerable adults but also children. She's very empathetic in terms of she's made it part of her everyday business, as a lot of other GPs and practices across the CCG have. But I really feel that Sonia's gone above and beyond the normal safeguarding assurances that we would expect really clinical staff and obviously member practices to have. And she's really promoted and championed the work that's gone on within those pilot sites. So I felt really that she's a beacon of success where it comes to safeguarding, certainly within her practice.
I nominated Sarafed Medical Centre for the work that they did with learning disabilities. So the doctor in charge is Dr. Chowdhury, and he was the lead for the CCG learning disability. So we've done a lot of work at the practice for learning disabilities, including health checks for our patients.
We have been working hard for the last few years on learning disability. Our uptake is quite good for the learning disability checks. And obviously, if anything requires intervention, we have been doing that for the last few years. This is a condition which requires cooperative work between the clinician, social services, and the CCG to work together. And working together, we can improve the uptake of uptake of health check and the care of the learning disability patients in the area.
We have noticed in our area that there is a lower uptake in health checks, so we've done a lot of work regarding that. So we invite patients in, we also do a template On the template it's a very easy to follow format, so there's lots of pictures which is helpful for learning disability patients. If we won the Equality Award we would feel very elated, but I think it would benefit our patients and staff morale also. I think there is a stigma around mental health and learning disabilities, so to win this award would perhaps encourage others to be more open, and perhaps other surgeries would do more work for mental health.